Okay, Joseph is a 5-year-old white male that presents to urgent care with his mother for 3 days of cough. Joseph has a past medical history of mild intermittent asthma and has had a tight, dry cough for 3 days. He woke up coughing last night. They gave albuterol and he was able to go back to sleep. He denies any pain but does say it's hard to breathe, and then he feels like chest tightness. Denies any audible wheezing, congestion, runny nose, fever, vomiting, diarrhea, or other pain. No concern for foreign body. Um, he says that he's noticed that he's been breathing harder when running around at recess at school. For relief, they've been giving 2 puffs of albuterol intermittently for the first 2 days, but then since yesterday, gave it in the morning and at night. Last time it was given was 3 hours ago. He says that albuterol helps his chest tightness and cough, and then it comes back when it wears off. He says it has happened before when he was sick or during allergy season. He doesn't use a controller medication and typically only has to use albuterol a couple times per month. They're doing 2 puffs with a spacer, and then mom brought the patient in today because she's concerned that the albuterol isn't helping anymore. For review of systems, they deny fever, chills, night sweats, fatigue, has states that he had to stop playing at recess when he feels short of breath, and then he can sit down for a few minutes and then go back to playing. HEENT denies headache, vision changes, eye pain, ear pain, any neck stiffness, runny nose, or sore throat. He does have a tight cough, but they deny any tracheal tugging or wheezing. No chest pain, palpitations, dizziness. So he has that shortness of breath and chest tightness when he's playing. For GI, denies nausea, vomiting, diarrhea, constipation, or abdominal pain. GU denies any GU symptoms, denies any weakness, soreness, injury, or limp. Has no lesions or bruising, denies any dizziness or gait disturbance, and then denies any behavioral concerns. For past medical history, is mild intermittent asthma with no previous ER visits or hospitalizations. He started taking albuterol last winter when his PCP prescribed it to him when sick. No surgical history, family medical history. Mom had asthma as a child but hasn't taken an inhaler since she was a teenager, and there's no other significant family medical history. Social history: lives at home with mom, dad, 2 older sisters, and a dog. No one smokes or vapes in the home. Only medication is the albuterol inhaler, which is 90 mics per puff, that he takes 2 puffs of as needed. Seasonal allergies in the spring, but has no known medication or food allergies, and then is up to date on immunizations. And he did get COVID and flu this season. For vitals, he was 37.1 degrees. His heart rate was 112, respiratory 32, 93% on room air, blood pressure was 92 over 63, and then 21.6 kilos. He was well appearing, well developed, well nourished, well hydrated, no acute distress. Bilateral tympanic membranes were pearly gray and reflective, with no nasal discharge noted. He had no lymphadenopathy in his neck. Um, his chest expansion was symmetric. There was noted to be an end expiratory wheeze on the right side and then clear on the left side. His respirations were regular with no grunting, flaring, or retracting. Heart rate and rhythm were regular with no murmurs. Abdomen was soft and non-tender. No GU exam was performed. He was alert and oriented ×3 with a steady gait. And then color and pigmentation were normal. Skin was warm and dry, and there were no rashes or lesions noted. For diagnostics, no labs or imaging were completed. If he would have had fever, increased work of breathing, a longer duration of cough, or asymmetric rales or crackles, then probably would have done a chest X-ray and then like a fluid swab. Differential is a uncomplicated asthma exacerbation due to his tight cough. His symptoms got better with albuterol. He has a nocturnal cough, worsens with exercise and seasonally. He has an end expiratory wheeze and then increased work of breathing, or he does not have any increased work of breathing. Also considered pneumonia as he has a cough and asymmetric lung sounds. However, has no rales or crackles, no increased work of breathing, no fever, and the cough has only been for 3 days. For anaphylaxis, we considered because of the cough and expiratory wheeze, however, has no increased work of breathing, no vomiting, urticaria, no exposure, And this has been a 3-day onset. We would expect it to be a little shorter with anaphylaxis. Same with foreign body aspiration. He has a cough and expiratory wheeze, but no vomiting, no increased rate of breathing, and then that longer onset. And then also considered GERD because he has cough and chest tightness, but it's not worse after eating. He doesn't endorse abdominal pain. The diagnosis that I went with was J45.2, mild intermittent asthma, uncomplicated. Um, for a management plan, he's greater than 20 kilos, so we switched his albuterol MDI from 2 puffs to 4 puffs. He got zero point 0.6 mg per kg of dexamethasone, which is 14 milligrams in clinic, and then reevaluated and monitored for 30 minutes, and he said he felt better. So we discharged him. The teaching we provided was that he should change his dose from 2 puffs to 4 puffs and then give every 4 hours while awake for the next 72 hours. He'll get a second dose of dexamethasone to be given in 24 hours and then follow up with PCP to confirm improvement and then for a possible palm referral. And then he should return to urgent care or the ED if he develops fever, lethargy, has difficulty breathing, develops retractions, or is needing albuterol more than every 4 hours. For the pathophysiology of asthma is characterized by airway inflammation, usually due to a trigger, which could include an allergen, irritant, infection, exercise, cold air, or stress. Mast cells in the airway are activated and then release histamine, leukotrienes, and prostaglandins, which increase mucus secretion and cause bronchoconstriction. And then the bronchoconstriction and increased mucus secretion limit airflow to the lungs, which causes the cough, wheeze, and respiratory distress. The chronic inflammation caused by asthma can affect the growth rate of children, and then long-term use of steroids can also cause growth suppression in children. And then during acute exacerbations, or if their asthma is not well controlled, they can have nutritional deficiencies or sleep disturbance, which could also affect growth. Frequent asthma exacerbations can limit participation in physical activities and sports, which could affect motor development and physical fitness. And then severe asthma could also limit a patient's participation in school, either because they have to miss days for hospitalization or for illness, or they have to miss class time to like go to a nurse's office to take an inhaler. And then it can affect social function, and that the patient may feel different than peers for needing to take medications every day or to stop or slow play to catch breath. And then this visit took place in Children's Southeast Aurora Urgent Care Campus, which is open from 11 a.m. to 8 p.m. 7 days a week, and sees patients aged 0 to 21. Many different populations are served at this setting, including families that have difficulty accessing primary care. We encountered families there who sought most of their health care through the emergency department or urgent care, and then families also that primarily spoke other languages. Many patients and their families encounter social determinants of health like food insecurity, family members with addiction, mental health crises, socioeconomic factors, unstable housing, difficulty accessing care, or unreliable transportation. These can affect growth because they cause increased illness, obesity, nutritional deficiency, can affect development due to limited access to education, chronic stress, lack of stable household, and then affect social function and that they cause chronic stress, mental health strain social relationship with friends, and then within the family. In this case, we were able to provide care after normal primary care hours, and then if the urgent care wasn't available, the child likely would have had to go to the emergency room for care or would have gone without care. And then in expediting this diagnosis, changing the dosage of the albuterol, and then providing the prescription for dexamethasone, this could stop this acute asthma exacerbation from progressing into needing more advanced treatment.